If you've been taking a blood pressure pill every morning for months or even years, whether it's amlodipine, losartan, or lisinopril, there's a question that most people never stop to seriously ask themselves. Do you actually understand what that medication is doing inside your body right now? Not the short sentence on the pharmacy label, not the simplified explanation of lowers blood pressure, but the real day-to-day effect it has on your heart, your blood vessels, and even your kidneys while you go about your normal life. Because the truth is, these are not mild background supplements. They are active, powerful drugs that continuously reshape how your circulatory system behaves. And when you don't fully understand that, you also miss the warning signs your body may already be giving you. Most people hesitate when asked this question, not because they are careless, but because no one ever really explained it in a way that connects the science to real life. And that gap matters more than most realize. These medications are taken by millions of older adults every single day, often on autopilot, with little awareness of what is normal, what is expected, and what should actually prompt a call to the doctor. That lack of clarity is where avoidable problems begin. My name is Dr. William, and the purpose of this channel is simple: to translate complex medical information into clear, practical understanding that fits into real life, not just a rushed clinic visit. Because in those 10-minute appointments, important details often get compressed or skipped entirely. By the end of this video, the goal is that you don't just know the names of your medications, you understand their behavior, their risks, and the subtle signals your body uses when something is off. To make that real, let's start with a story. A man named Walter, 74 years old, a retired engineer, someone who approached life with precision and discipline. He never missed a dose. His pill organizer was structured like a project schedule, carefully sorted from Monday to Sunday. When his doctor added amlodipine to his existing blood pressure treatment, Walter didn't think much of it. It was just another medication in the same category, another step in controlling his numbers. That assumption seemed harmless at first, but over time, it changed everything. A few months later, Walter noticed something unusual. His shoes felt tighter. Then his ankles started to swell by the end of the day. By late afternoon, his legs felt heavy, almost tired in a way he couldn't explain. Walking became less appealing, not because of pain exactly, but because it felt like his body was carrying extra weight. He began to worry that something serious was happening with his heart or circulation. Like many people would, he turned to the internet, searching for heart failure symptoms, trying to connect the dots on his own. What Walter didn't realize was that the explanation wasn't hidden or rare. It was simply never made clear to him. Amlodipine, lisinopril, and losartan are often grouped together in everyday conversation as blood pressure medications, but they do not work the same way at all. That difference is not minor. It changes both their effects and their side effects. Amlodipine belongs to a class called calcium channel blockers. In practical terms, it relaxes the smooth muscle in your arteries, allowing blood to flow through with less resistance. Lisinopril, on the other hand, is an ACE inhibitor. It works by blocking an enzyme in your body that naturally tightens blood vessels, so by stopping that process, it lowers pressure. Losartan is part of a different but related system called ARBs, which also reduce vessel tightening, but through a separate pathway. 3 different mechanisms, all aiming for the same outcome: lower blood pressure. But how they get there, and what they do along the way, is not the same. That distinction is exactly why Walter's experience developed the way it did. His swelling wasn't a sign that his heart was failing. It was a known and fairly common effect of amlodipine in some people. When arteries relax more than the veins that return blood upward, fluid can begin to pool in the lower parts of the body, especially the ankles and feet. Over time, that creates visible swelling, heaviness, and discomfort. It looks alarming, but in many cases, it is a predictable response to the medication's mechanism, not a sign of sudden heart damage. What becomes dangerous is not the swelling itself, but how people interpret it. Some stop the medication abruptly, thinking they are solving a problem, when in reality, their blood pressure quietly rises again without symptoms. Others reduce water intake, assuming fluid is the enemy, which can make the situation worse. And some simply endure it in silence, assuming it is just part of aging or illness, when adjustments could have significantly improved their comfort and mobility. Walter's case changed once the real cause was identified and addressed with his doctor. Small adjustments and proper understanding made a meaningful difference, and within weeks, his daily discomfort improved enough that he returned to normal walking again. The important lesson here is not that amlodipine is dangerous, but that every medication has a pattern, and recognizing that pattern is what prevents confusion and unnecessary fear. And this is where things become even more important, because swelling is just one piece of the picture. The same level of misunderstanding exists with other medications in this group, especially when it comes to symptoms that don't look dramatic at first, but slowly affect quality of life in ways people often don't connect to their prescription. Another medication that often gets misunderstood in exactly the same way is lisinopril, and what makes it tricky is that its most common side effect doesn't look dangerous at first glance. In fact, it usually looks harmless enough that most people don't even connect it to the medication. One of the hallmark reactions with ACE inhibitors like lisinopril is a persistent dry cough. Not a chesty cough, not something that produces mucus, but a stubborn, irritating tickle deep in the throat that keeps coming back. It often feels worse at night, and it doesn't respond to the usual remedies people try: cough drops, allergy tablets, or cold medications. That alone makes it confusing, because it doesn't behave like a typical respiratory issue. What makes this even more misleading is timing. This cough doesn't always appear immediately after starting the medication. For some people, it shows up within days, but for many others, it takes weeks or even months. By the time it starts, the medication has already become part of their routine, which makes it harder to suspect. Naturally, people look for other explanations first: seasonal allergies, lingering effects of a cold, dry air, or even acid reflux. This is exactly what happened with a woman named Evelyn. She was 71, active, and spent a lot of her time gardening. When her cough started in spring, she assumed it was pollen related. The timing made sense, so she treated it like an allergy problem. She tried antihistamines, changed her environment, even added an air purifier at home. Nothing made a difference. The cough persisted quietly but consistently, slowly affecting her sleep and energy. Even after visiting her doctor and getting a chest x-ray that came back normal, the symptom didn't go away. That result, in a way, made things more confusing, because everything looked medically fine on paper, yet her daily experience was clearly not fine. Months passed like this, with the cough becoming a constant background issue she had simply learned to tolerate. The missing link only became clear when the timeline was reviewed carefully. She had started lisinopril several months before the cough began. That connection is often overlooked because the gap between starting the medication and developing symptoms can make them feel unrelated. But once the possibility was considered, the picture changed quickly. When her doctor switched her from lisinopril to Losartan, the improvement was noticeable within a short time. The cough gradually faded, and within about 2 weeks, her sleep returned to normal. What had felt like a long, unexplained respiratory issue turned out to be a medication-specific side effect that simply required a change in approach. But there is an even more important point with lisinopril that goes beyond discomfort. There is a rare reaction that must never be ignored, even if everything else about the medication feels familiar and safe. It is called angioedema, and while it is uncommon, it is serious. Angioedema involves sudden swelling of the lips, tongue, face, or throat. Unlike the dry cough, this is not something to observe and wait on. If it affects breathing or swallowing, it becomes an emergency situation. The key issue is that it can progress quickly, and it does not always give much warning. That is why any sign of facial or throat swelling while taking an ACE inhibitor requires immediate medical attention without delay. The difference between a harmless side effect like a cough and a dangerous reaction like angioedema is not always obvious in the moment, which is why awareness matters so much. One affects comfort, the other can affect breathing, and the response to each must be completely different. Now, while lisinopril works through one pathway in the body, losartan operates in a slightly different part of the same regulatory system. And that difference creates its own set of risks, not from obvious symptoms, but from something far more subtle and often completely unnoticed until it becomes a problem. Losartan is part of a group of medications that can increase potassium levels in the blood. In controlled amounts, this is usually not an issue, especially when patients are monitored properly. The problem arises when additional sources of potassium are added without realizing it. This is where everyday habits can quietly change the balance inside the body. One of the most common examples comes from something many people assume is healthier: salt substitutes. These products often replace sodium with potassium chloride. On the surface, this seems like a good idea, especially for people told to reduce salt intake. But for someone already taking medications like Losartan, this can unintentionally push potassium levels too high. The body doesn't always announce this clearly at first. High potassium can develop slowly, and symptoms may be vague: fatigue, muscle weakness, mild cramping, or a general sense that something feels off. In some cases, there are no obvious symptoms until the levels become significantly elevated, which is why it often goes unnoticed. This becomes even more important when combined with other everyday products. Certain sports drinks, electrolyte powders, and meal replacements also contain potassium. Individually, none of these are dangerous, but layered together with medication, they can quietly shift the body's balance without anyone realizing it. There is another situation where these medications become especially sensitive, and it's something many people don't anticipate: illness or dehydration. A stomach virus, diarrhea, vomiting, or even a few very hot days with poor fluid intake can change how the body responds to the same dose of medication. When the body is dehydrated, blood pressure can drop more than expected, and the kidneys become more vulnerable. This is why so-called sick day planning matters. During illness, the way blood pressure medications behave can change, and in some cases, temporary adjustments may be needed under medical guidance. Yet this is one of the least discussed topics in routine care, even though it can make a real difference in preventing complications. A situation that catches many people off guard is the routine use of common painkillers while taking blood pressure medications. On the surface, it doesn't seem like a problem. Medications like ibuprofen or naproxen are available over the counter, widely used, and generally considered safe when taken occasionally. But the interaction they have with blood pressure drugs like lisinopril, losartan, and sometimes even diuretics can quietly place stress on the kidneys in ways most people never think about. The key issue is how these drugs affect blood flow to the kidneys. Blood pressure medications are designed to modify the body's internal pressure systems to protect the heart and blood vessels. Meanwhile, nonsteroidal anti-inflammatory drugs, or NSAIDs, reduce inflammation by affecting certain chemical pathways that also help maintain blood flow to the kidneys. When both are used together regularly, especially in older adults or in situations where hydration is low, the balance that keeps kidney function stable can become disrupted. This doesn't usually cause immediate symptoms, which is part of the reason it is so often overlooked. People don't feel a sudden change. Instead, the effect builds quietly in the background. In some cases, kidney function can decline without obvious warning signs until blood tests reveal the change. That's why it is not about occasional use of a painkiller, but rather frequent or repeated use over time while already on blood pressure therapy. What makes this even more complicated is that many people don't categorize over-the-counter medications as real medications in the same way they think about prescriptions, so they may not mention them during doctor visits. A person might say they are taking lisinopril or losartan, but not think to include ibuprofen they take several times a week for joint pain. From a medical perspective, however, the kidneys respond to the full combination, not the label on the bottle. There are often safer approaches available, depending on the situation. Acetaminophen is sometimes used as an alternative for pain relief because it does not carry the same level of kidney-related interaction risk. In other cases, topical treatments, physical therapy, or adjusting the underlying cause of pain can reduce the need for frequent NSAID use. The important point is not to ignore pain, but to recognize that there are usually multiple ways to manage it without adding unnecessary strain to the body. Another area that is frequently underestimated is dizziness. Many people on blood pressure medications experience brief moments of lightheadedness, especially when standing up quickly. It may last only a few seconds and then pass, which makes it easy to dismiss as normal or insignificant. But in older adults, even a short loss of balance can have serious consequences. Blood pressure medications lower pressure throughout the body by design. When a person moves from sitting or lying down to standing, the cardiovascular system needs a moment to adjust. If that adjustment is slightly delayed, blood flow to the brain can drop briefly, causing that familiar head rush or unsteady feeling. While this is often mild, it becomes important when it increases the risk of falls. Falls in older adults are not minor events. Even a single fall can lead to fractures, hospitalization, and a long recovery process. In some cases, it can permanently change mobility and independence. This is why recurring dizziness should never be ignored, even if it feels brief or manageable. It may indicate that timing, dosage, hydration, or medication combinations need to be reviewed. Simple adjustments often help. Standing up slowly, pausing at the edge of the bed before walking, and making sure hydration is consistent throughout the day can reduce symptoms significantly. But when dizziness persists or worsens, it is a signal that deserves medical attention rather than adaptation alone. One of the most misunderstood aspects of managing blood pressure at home is how readings are interpreted. Blood pressure is not a fixed number. It constantly changes throughout the day based on activity, stress, sleep, food, hydration, and even the act of measuring itself. A single reading, taken in isolation, does not define whether a medication is working or failing. For example, a higher than usual reading after a poor night's sleep or a stressful morning does not automatically mean the treatment has stopped working. Similarly, a lower reading after dehydration or heat exposure does not necessarily mean the dose is too strong. The real value comes from patterns over time, not individual moments. This is where many unnecessary decisions begin. People sometimes adjust or skip doses based on one reading, or become anxious after seeing a number that feels out of range. But blood pressure management is meant to be steady and consistent, not reactive. The goal is to observe trends over days and weeks under similar conditions, not to respond emotionally to isolated fluctuations. When readings are taken properly, same time of day, same arm, after a few minutes of rest, they become far more meaningful. A consistent log provides much clearer insight than occasional checks driven by concern. It also gives healthcare providers better information to adjust treatment safely and effectively. At the center of all of this is a simple idea. These medications are designed to work continuously in the background. They are not emergency tools, and they are not meant to be adjusted based on moment-to-moment changes. Understanding that difference is what helps transform confusion into control and uncertainty into safer long-term management. A major part of safe blood pressure management that often gets overlooked is something very simple in concept, but extremely important in practice: consistency. These medications, Amlodipine, Lisinopril, and Losartan, are not designed to work like quick response drugs that you take only when something feels wrong. They are built to maintain a steady effect in the background of your body, quietly shaping blood vessel behavior, kidney function, and fluid balance over long periods of time. That's why one of the most common mistakes happens when people start treating them like as needed medications in practice, even if they were prescribed as daily therapy. Some people skip doses when their blood pressure reading looks good, thinking they no longer need the pill. Others take an extra dose when a reading looks high, trying to correct it quickly. Both approaches create instability, and instability is exactly what these medications are meant to prevent. Blood pressure doesn't work like a switch that flips between normal and abnormal. It responds to sleep quality, stress levels, hydration, physical activity, food intake, and even emotional state. Because of this, a single reading can be misleading in both directions. A high reading does not necessarily mean the medication has failed, and a low reading does not automatically mean the dose is too strong. What matters is the pattern across time, not the snapshot of a single moment. This is why consistent measurement habits matter so much. Taking readings at random times, under different conditions, or during moments of stress can create a distorted picture. In contrast, checking at the same time each day, after a short rest period, and under similar conditions gives a far more accurate reflection of how the body is actually responding. Over time, those patterns become more useful than any individual number. When people begin reacting emotionally to isolated readings, it often leads to unnecessary changes. Extra doses taken out of concern can lower blood pressure too much, increasing the risk of dizziness or fainting. Skip doses, based on reassurance from a single good reading, can allow pressure to rise again silently. In both cases, The system becomes less predictable, not more controlled. This unpredictability becomes especially important in older adults, where even small fluctuations can have larger physical consequences. A brief drop in blood pressure after standing, combined with dehydration or medication overlap, can be enough to cause imbalance. What might seem like a minor adjustment in medication use can therefore translate into real physical risk over time. Another key point is that these medications often interact with everyday habits that people don't think twice about. Hydration, diet, and over the counter products all play a role in how the body responds. Something as simple as drinking less water during a hot day, or using a painkiller more frequently during a period of joint pain, can subtly change how the medication behaves inside the system. These are not dramatic changes, but gradual shifts that accumulate. Because of this, communication with healthcare providers becomes essential, not just at the moment of prescription, but continuously as life changes. New symptoms, new supplements, new habits, or even seasonal changes in routine can all affect how these medications perform. Yet many of these details are never mentioned during routine visits simply because they seem too small or unrelated. There is also an important emotional aspect to this. Many people quietly assume that if they are prescribed a medication long term, it must mean their condition is fixed and stable in a simple way. But blood pressure management is not a static condition, it is a continuous balancing process between medication, lifestyle, and the body's natural variability. Understanding this reduces both fear and false confidence. When people stop expecting perfection from a single number and instead focus on trends, patterns, and symptoms, decision making becomes calmer and more accurate. The goal shifts away from reacting to individual moments and toward maintaining long term stability. That shift alone prevents a large number of unnecessary adjustments and worries. Ultimately, the most important takeaway is that these medications are effective when they are understood as systems, not just pills. They are part of a larger picture that includes hydration, diet, activity, illness, and daily habits. When all of these elements are considered together, blood pressure becomes far more manageable and far less confusing. And with that understanding in place, the final step is recognizing when normal side effects end and true warning signs begin. Because knowing that difference is what turns routine medication use into truly safe long-term care. Now that we've looked at how these medications work in everyday life, there's one final layer that brings everything together: knowing the difference between expected side effects and genuine warning signs that require immediate attention. This distinction is where safety really becomes practical, because most of the confusion people experience comes from not knowing which symptoms are normal adjustments and which ones signal something more serious. With amlodipine, for example, mild ankle swelling or a feeling of heaviness in the legs can be a known and fairly common effect. It develops gradually, often worsens toward the end of the day, and is usually related to how the medication changes blood vessel behavior. On its own, and when stable, it is not typically an emergency. But the key detail is change. If swelling suddenly becomes severe, rapidly worsens, or is accompanied by shortness of breath or chest discomfort, that is no longer in the expected side effect category and needs medical evaluation. With lisinopril and other ACE inhibitors, a dry, persistent cough is one of the most recognized non-dangerous side effects. It can be annoying, disruptive, and long-lasting, but it does not usually indicate immediate harm. However, there is a very different scenario that cannot be ignored: sudden swelling of the lips, tongue, face, or throat. Unlike the cough, this reaction can develop quickly and may affect breathing or swallowing. This is angioedema, and it requires urgent medical attention without delay. The difference between irritation and airway risk is absolute in this case. Losartan and similar medications bring a different kind of challenge because their side effects are often less visible. Changes in potassium levels, for instance, may not produce obvious symptoms right away. When symptoms do appear, they can be subtle at first: fatigue, muscle weakness, or mild irregular heart sensations. These signs are easy to dismiss or attribute to aging, stress, or daily tiredness. But in combination with diet, supplements, or salt substitutes high in potassium, the risk becomes more significant and should be monitored through regular medical testing, rather than self-observation alone. Another important area involves dehydration and illness. When the body is losing fluids due to vomiting, diarrhea, fever, or excessive heat, the same medication dose can have a much stronger effect than usual. Blood pressure may drop too far, dizziness may increase, and kidney function can become more vulnerable. This doesn't mean the medication is suddenly dangerous on its own. It means the conditions inside the body have changed. This is why sick day rules from a doctor are so important, even though they are rarely discussed in detail during routine visits. Pain medications also deserve attention here. Occasional use of over-the-counter drugs like ibuprofen may not cause issues for most people, but frequent or combined use with blood pressure medications can place additional strain on kidney function. This is especially relevant in older adults or in those who are already managing multiple conditions. The risk is not always immediate pain or symptoms, but gradual changes that only show up in blood tests over time. Dizziness is another signal that sits in a gray zone. A brief lightheaded feeling when standing up quickly can be a common and expected effect of blood pressure lowering. But repeated episodes, worsening symptoms, or near fainting events are different. They suggest that the current balance between medication, hydration, and blood pressure may need adjustment. Ignoring these signals increases the risk of falls, which can have serious consequences in older adults. What ties all of this together is not fear, but awareness. These medications are widely used for good reason. They significantly reduce the risk of stroke, heart attack, and long-term cardiovascular complications. But their benefits depend on correct use, proper monitoring, and understanding how the body responds over time. The safest approach is not to react to every small change, but also not to ignore persistent patterns. One isolated symptom is often not meaningful. A pattern of symptoms, especially when new or worsening, is where attention is needed. That balance between observation and overreaction is what keeps treatment both effective and safe. In the end, managing blood pressure is not just about taking a pill every morning. It is about understanding how that pill interacts with your daily life, your habits, and your body's natural changes. When that understanding is in place, these medications become far more predictable, and the sense of uncertainty that many people feel starts to fade. Because the goal is not just lower numbers on a screen, it is stability, safety, and long-term quality of life.